Welcome to the Health Zone. We have a wonderful show lined up for you today. It's on a serious topic, breast cancer, but we have two terrific guests with us. One has come all the way from the United States to be with us. His name is Professor Chummy Nwogu. And Professor Chummy is a surgical oncologist. That means he's a surgeon that specializes in everything cancer. We're really honored to have him with us. He is a professor at the Roswell Park Cancer Institute in the United States, but he's also CEO of the Lakeshore Cancer Center right here in Lagos, Nigeria. It's a pleasure to have him with us in the studio. Professor Chummy, welcome to the Health Zone.
Thank you so much, Dr. Toju, for having me here.
It's my pleasure.
I'm really glad to be here.
It's great to have you here. Our next guest is not a stranger to the Health Zone. We've had her on the show before, and we are so glad to have her back. Dr. Oge Ilegbune is a general practitioner who is focused on screening and preventive health practices. She actually works with Professor Chummy at the Lakeshore Cancer Center as the head of strategy, development, and outreach. She is passionate about eradicating cancer in Nigeria, so she's the perfect person to have with us here on the show. Dr. Oge, welcome to the Health Zone. It's so nice to have you back.
Thank you very much, Toju. It's a pleasure to be back again.
No, it's my pleasure to have you here. So now you know, Dr. Oge, that we have a tradition here on the Health Zone. We always go to the man and woman on the street to find out what they know about breast cancer before we get into the meat of the discussion. So let's watch the video.
Today we will be talking to the man on the street. What type of cancer do you think, or do you know as the most popular type of cancer in Africa?
Well, I think breast cancer.
That's cervical cancer. My sister had cervical cancer.
Breast cancer.
Do you know of anybody who has breast cancer, who has been diagnosed with breast cancer?
The point is that people don't speak out. So I'm sure there are people close to me or that I should know that do have breast cancer, but they don't speak out. No, I don't know of anyone.
Yes, I know a woman who was diagnosed with breast cancer, and her breast was cut off.
Have you ever gone to test yourself at the hospital or by yourself?
I have to do a self-test, just go around, touch it around, and then find out if I can get any lump in there and all that. With all the noise going on, I kind of read up a piece about it. There's a way you check for lumps and things like that. I do that for myself.
Early detection is key to solving these problems. But they said constant sucking really removes every trace of, such, yeah.
What can I say? I mean, there are lots of beliefs out there. There are lots of beliefs out here. That's why we're here today, right?
Exactly.
To talk about it.
So you know what? Let's not say anything. Just please, what is cancer?
Yeah. So, going back to the basics, cancer is really a collection of diseases where the cells that we have in our body lose control of their division and multiplication. So these cells grow without limit, and then they form these clumps, these tumors, and they can break away from where they started and go to other organs. So as they continue to grow, they take over the function of the body. They take nutrients away from the normal cells. So that's really what cancer is all about.
Okay. So what causes it though? What is it that causes these cells to lose that control and go beyond the limits and just keep growing? What is responsible for that?
Well, oftentimes there's no specific cause, but there are various things that can come together to actually make the cells lose that control. There are some things that we can inherit from our parents. So there are certain genes that we can inherit from our parents that can make it more likely that we would have cancer. It's not like those genes per se will cause the cancer, but they make an individual more likely to have cancer. But then there are other things in our environment. It could be things like smoking. It could be things like exposure to radiation. It could be different viruses, like in cervical cancer, for instance, somebody could have a virus. So there are different things. But, we're talking about breast cancer today. So there is no specific cause of breast cancer, but a number of these factors can come together to make the cells in the breast lose that control.
So, Dr. Oge, why do we need to be talking about cancer? Why is it important that we talk about cancer here in Africa?
I think at this point in time, it's quite obvious that people know about cancer. They've heard about someone having cancer either at work, in the office, within the family, and there's a fear surrounding it. There's a huge impact when you have a cancer diagnosis, especially in an environment where the diagnosis usually is quite late. It's emotionally very traumatic. There's a financial cost to it as well. And actually, people always ask us as doctors, what's going on? Everybody seems to have cancer now. And without even going through statistics and studies, it does seem that, the rates and the incidence is increasing, not just in Nigeria, but in a lot of sub-Saharan African countries as well. We also have the troubling fact that we have very limited resources to deal with it. We also know that people are living longer.
Yes.
So, you have this burden with cancer diagnosis.
So, Professor Chummy, I know you sort of alluded to it earlier, that we're not really quite sure what triggers the cancer, the cells to go out of control. What do we know today about breast cancer in terms of what are some of the causes?
Yeah. So we do know that there are certain family predispositions. What that means is that there are certain things we can inherit from our parents that can make us more likely to have cancer. It doesn't mean that having those genes means that we will certainly have it, but they make us more likely to have cancer. Then there are certain other factors. If somebody has hormonal replacement treatment, that is, if somebody uses certain contraceptives that have a high concentration of these hormones in a certain kind of balance, that might predispose to it. After menopause, if somebody is getting hormonal replacement therapy, there's some of those medications that can predispose to cancer. There are certain reproductive risks, depending on when somebody started having their period, whether they ended it late, depending on if somebody did not get pregnant or did not breastfeed. So there are a number of factors that can increase the risk slightly. None of these factors in of itself is going to cause cancer, but sometimes some of these things can accumulate to cause cancer.
Okay. So, Dr. Oge, you're a woman. So I know he alluded to some of those reproductive, things. So what are these things, reproductive issues that can put women at risk? And are there any other issues that can put women at risk, meaning that makes it more likely that they could have breast cancer?
Okay. Dr. Chummy has touched on most of the risk factors. And like he said, it's a multifactorial group of things coming together. For women, you find that if you've never had a baby, for instance, if you've not been breastfeeding, those are also factors. Even being female is a risk factor.
Exactly.
It's a risk factor. We also find that just like other cancers, increasing age would also affect a woman. You also find that there are certain contraceptive combinations, like he said, especially high in estrogens, which would put you at risk. Hormone replacement therapies as well would also increase the risk of having breast cancer.
Okay. So, Professor Chummy, tell us, what are some of the statistics around breast cancer here in Africa?
Yeah, that's a really good question. Breast cancer is the commonest cancer that exists in our society. So as
this is men and women.
Yes, as Dr. Oge alluded to, breast cancer is the most common cancer. It can happen in men and women, but it's a lot more common in women. Okay. It's not frequently seen in men, but because of that, sometimes when a man has a lump, he doesn't even
ignores
consider
it.
the fact that it could be cancerous. So it is very important for us to emphasize that men can have breast cancer. So if there's a lump in a man, the person should seek attention. But definitely, so it's a very common disease, mostly in women, but it's also the commonest cause of cancer deaths in a lot of countries in sub-Saharan Africa. There are some countries where cervical cancer might be a little bit more common as cause of death.
Yeah.
There are some where breast cancer will be a little bit more common, but both of them are issues. Breast cancer is a big deal. And another thing that is very important for us to realize that in our society, a lot of our young women have these cancers early. So earlier than other countries. So as a matter of fact, we will get to talking about screening guidelines, but this is an issue here. What is most appropriate for us here in our environment? People are presenting very early.
What should somebody be looking out for if they find that this is something I need to to pay attention to?
Right, thank you. That's a very important question, actually, and I'll explain why. Most people always think, oh, breast cancer lump. But actually, there are all sorts of ways, of manifestation, and it's not always a lump. So a lump is very, clear. We all know about that. But even the change in the size, the shape of the breast itself. So if, you've always looked at your breast and suddenly one breast looks bigger, becomes a bit misshapen, then you know that something is going on there. The other signs and symptoms could be the fact that if your nipples were out before, they become inverted, what we call inverted.
Yeah.
So it turns in, again, that is, a cause for you to see a doctor or, a nurse. If you notice that you have a rash, probably a rash around the nipple, around what we call the areola, the dark part around the nipple, and it's not going away, you keep using creams, again, that's a cause for you to see someone. And if you notice as well, there's something we call peau d'orange, the skin around the breast changes, looks a bit like orange peel. Again, you need to see someone. So, these are various ways of actually noting that something unusual is going on. And this is when the cancer is sort of local. If we're talking about complications, when it's advanced, then you will have other symptoms.
What options do we have here in Africa to catch breast cancer early?
The one thing I say to women is, most of us know when we have a pimple on our face, because you're looking, you're beautifying yourself. And one of the important things you can do is also get to know your breasts. Yeah. So that self-breast examination is very important. It's not 100%. It doesn't say, oh, for sure, you're going to get a cancer each time you do that. But the whole idea is you begin to know your breast so well that if 2 months down the line you notice something, you're not even confused. You know that
it wasn't there before.
It wasn't there before. So
Yes.
and then you can go to a doctor who can then actually examine and decide, do you need a mammogram, do you need an ultrasound, or is it something actually to do with your time of month?
Yes.
Exactly. Every time, every month, 5 to 7 days after your period, you should stand in front of a mirror, lie on the bed and examine your breasts.
Okay, great. So, Professor Chummy, when we're talking about screening to catch early breast cancer, what are the options that are available to us here?
Once a young woman starts menstruating, they should start getting into the habit of doing self-breast exam.
Like Dr. Oge
Dr.
said.
Oge just said it already now. So, and that way the person gets used to what their breasts look like. What we refer to as clinical breast exam is when a doctor or a nurse does the examination of the breast for the woman. Some organizations recommend that we start that at the age of 25. So from 25 years onwards, once or twice a year, having a clinical breast exam. And that is something that is generally affordable in our environment. The other thing, as a woman gets to the age of 40 and above, once or twice a year doing a mammogram, which is an x-ray of the breasts.
Yes. So Dr. Oge, what is the cost of a mammogram?
So depending on the center where you go, it's between about 10,000 naira right up to about 20,000 naira. Okay. So that's the sort of range. It depends on the center. And I think for mammogram being done once every year or once every 2 years, it's actually affordable.
And I actually know of a family where the father had prostate cancer, 2 of his children, girls, women, had breast cancer. And so they finally tested the family, and it turns out that they have the genetic predisposition. They have a gene for cancer. And what knowing that, as scary as that is, what it has done for the entire family, including granddaughters, is that it's made everybody more aware of having a healthy lifestyle. So they're eating better, they're exercising, they're watching their weight, they're making sure they're limiting alcohol, they're doing all the things that they need to do, that's within their power to prevent the likelihood of getting breast cancer. So knowing is, knowledge is power. We say that all the time. Knowledge is also power when it comes to screening for diseases. So as we're rounding up, Professor Chummy, if you can just tell us quickly what the treatment for breast cancer is.
I think that the treatment really depends on the stage of the cancer. If we detect it earlier, the treatment is a lot simpler, a lot more affordable. And the good news is that if we detect it very early, we can treat it without removing the entire breast.
Because that's a fear for many women, removing the breast.
That's a
for
big
their
fear.
women and for their significant spouses
Yes.
or others. Yes.
So that's very important. If we detect it very early, the actual tumor can be removed without removing the entire breast.
Yes.
So lumpectomy or breast preservation surgery.
Yeah.
So surgery is one aspect of treatment. Other tools that we can use include radiation treatment. That's where we're using these powerful X-ray beams to treat the cancer. We also have chemotherapy, where you are given either pills or medications IV to attack cancer cells. Sometimes you use all these things in combination. It really depends on the extent of the cancer. Then you also have hormonal treatment.
Yeah.
So some of these cancers, we do some testing to find out whether they are hormone receptor positive. That means that these are cancers that require certain hormones to grow.
Yes.
So if we can then give the patient, the individual medications that decrease the level of those hormones, it can be very effective to either treat the cancer or prevent it from coming back.
Yes.
So there are things. And then there are a few other agents. There are some special drugs, medications that are more targeted treatments that are a little bit more expensive. So, but there's a combination. There's a whole range of things that can be done.
Professor Chummy, I have another question for you. But no. You know what? I keep thinking about the man on the street interview that we saw, and I have to ask you this. Please address the guy that said sucking on the breast will prevent breast cancer. Please tell us what the truth is on this matter.
What can I say? I mean, I don't even know where to begin with this question, but we have to try to answer this question scientifically, right? There is no scientific study that suggests that a man sucking on his wife's breast will prevent breast cancer. As far as dealing with breast cancer, we know that breastfeeding, that means feeding a baby, has some benefits, some protective benefit.
The main function of the breast is to produce milk.
Yes.
And so we know that some cancer cells start from the ducts that the milk come through, and so it makes sense that if a baby is, sucking and, for the milk, that the breast is doing what it's supposed to do. And so that in itself is a protection for the breast. But just a man randomly just sucking on a breast that's not, no. But thank you. I'm glad it was you, the guy, right, that addressed this issue. The man is the one. So men, you have heard from Professor Chummy himself, there is no scientific data to support that belief that sucking makes a difference. Dr. Oge and Professor Chummy, thank you so very much for being with us here on the show and just shedding light on this whole scary, very scary issue of breast cancer. We really appreciate your coming on the show, and we will definitely invite you because, there's so many cancers. So we will have you come back and lend us your expertise again. Thank you both very much for joining us here on the show.
Thank you.
Thank you so much for having us.
It's been my pleasure. So we have been talking with Professor Chummy and Dr. Oge about breast cancer, and we have learned so much. They touched on many important things, so please don't go away. When we come back from the break, I will recap some of the important things that they said. Stay with us. We learned so many important things about breast cancer from Dr. Oge and Professor Chummy. So I'm just going to recap some of the highlights of what they talked about. There isn't any one single thing that causes breast cancer. It's likely to be a complex combination of many factors, such as the environment, your genetics, your lifestyle, whether you eat healthy, you're overweight, you drink, you smoke, and even sometimes reproductive issues can all be a factor in the development of breast cancer. Breast cancer screening tests like a mammogram can help find cancer at an early stage before the symptoms appear and when it may be easier to treat, because oftentimes by the time symptoms appear, the cancer may have grown and spread and can make it harder to treat. General signs and symptoms of breast cancer include a breast lump that feels different from the surrounding tissue, change in the size, the shape, or appearance of the breast, changes in the skin over the breast, such as dimpling, peeling, thickening, or something that we call peau d'orange, where the skin over the breast looks like an orange with pits, with holes in it. And sometimes your nipple changes position, and instead of pointing out, it gets inverted. Breast cancer is potentially life-threatening, and treatment can be hard on the body, often requiring a combination of surgery, chemotherapy, and radiation. It is therefore important that we all make every effort for prevention. You can make lifestyle changes that can lower your risk for breast cancer, such as eating healthy foods, exercising regularly, maintaining a healthy weight, and if you drink, limit your alcohol. And finally, as a woman, you need to become familiar with your breasts through breast self-exam so that at the first sign of a problem, you can pick it up. Thank you so much for joining us today on the Health Zone. This is Dr. Toju reminding you to stay healthy.